In this video, we're going to be taking a look at family system recovery and what it looks like when you are in a family system that has active pathology or active substance use going on. So, active pathology could encompass anything under the mental illness umbrella. There could be personality disorder issues, there could be untreated mental illness like bipolar, anxiety, depression. It could be traits like narcissism or borderline personality disorder or codependency. So, anything in the family system that is creating dynamics. And we're going to take a look at both of those. So you will hear me reference active pathology and or substance use throughout the video. So what we're looking at here in this first graphic is going to be the basis for the rest of the video, and we're going to maneuver some things in this graphic to rearrange and try to healthify the family system. So in this first graphic, I'll walk you through each piece of this because there's a lot going on here. So first, in the middle, we have John. John would be what we would call the identified patient, so the person with the active pathology and or substance use happening. On the outer ring, you've got the people in John's life. Under the people, you have the symptoms that they're currently displaying and or the approach that they're taking towards John right now. Attached to them, there's going to be a little bubble icon with a graphic in it that represents possibly the ways that these folks have ended up numbing and medicating all of the symptoms that they are experiencing as it relates to dealing with quote unquote John. What we are looking at is a disempowered and a trauma bonded family. You could also use the word codependency in the sense that we're looking at people who are all bonded over whatever pathology and substance use disorder is happening. Most of the time, when you ask someone in this current family system how they're doing, they're going to respond with some version of how John is doing and therefore how they are doing. So we know that the definition of codependency sounds like I am however you are. And so, for a concrete example, this would be, let's say I'm sister and I'm calling mom and I'm saying, "Hey, mom, how are you doing?" And her response is, "Well, your brother's not doing well again. He's back in detox. He's um, the back in his outpatient program. He's relapsed again. He's showing behaviors again. He stopped taking his medications, those sorts of things." And so the answer for how mom is doing is so closely tied to how John is doing. That is the reason it's a disempowered system, because it is all dependent on how the person in the center is doing. And that's what we're looking to switch around. And that's what would convert this from being a family in dysfunction to a family in recovery. So this next slide shows what we're going to want to do first. The first thing we want to do is we want to get John out of the middle of this graphic. He himself has not caused any of what is happening here. And I always clarify that by saying he may have some behavioral symptoms that create dynamics. And it is likely that the way he behaves, interacts, all of that with the family does increase some of the symptoms or does impact some of the symptoms. But the reason that I'm removing John from the middle here is because we're going to really try to shift our thinking into it is pathology or substance use that is impacting the family system, not John himself. So, a couple of things are happening here. One, we've removed John from the middle, and we've replaced that with just active pathology or substance use disorder. That is the thing that is creating the impact on the rest of the family. And so, if I look at mom, for example, I'm looking at her sadness, her anxiousness, her need for daily contact with a person, her desire to rescue, her desire to do anything at all to help, lots of codependency going on in her bubble. All of that is a result of trying to be in relationship with active pathology or substance use, and there isn't a healthy way to do that. So, one thing that we've done in this graphic is we've switched around the direction of the arrows. And the reason that we're doing that is because we're starting to take some accountability and shift the focus off of John, start to understand that I have active pathology and substance use disorders in my family. They are happening. And I'm going to start to take some responsibility over what impact that is having on me as a person. The second thing that you're seeing in this graphic is that I've actually moved John to be someone who is in that outer circle. And the reason that I've done that is because he is also someone in this family system who is being actively impacted by the active pathology or substance use disorder. Yes, he is the one who, quote unquote, has it, but he is a victim to it in the same way that a lot of the people in the system are. So we would look at more of a medical model to try to neutralize this a bit, because I do understand that with mental illness and with substance use disorders, it can feel very much like, no, no, this person is choosing to or choosing not to, if it's medication compliance and things like that. And that is what is impacting everyone else. But when we look at a medical model and we would look at a more neutral or maybe less behavioral pathology, disease is another word for that. We would be saying, because my mom has lung disease, I am impacted in these ways, and these are the symptoms that I'm having. I am feeling distressed. I am feeling sad. I am feeling anxious. I am feeling all these things because of the lung disease, not because of her. And in the same way, my mom would be someone on that outer ring who would be impacted by the lung disease, and her symptoms might look different. Her symptoms might be things like difficulty breathing or um, restricted airflow, those sorts of things. And so we're going to pull John out and we're going to put him on the outer ring with the rest of us. And we're going to say all of us are being affected by active pathology and or substance use disorder. It's really important to feel the shift of the arrows here, because what we're trying to do is have everybody less focused on the active pathology and more focused on self and what symptoms I am currently having that are impacting me. So, there are some ways that this plays out, and I'm going to try to give some personal examples here just to help humanize this a little bit, to help give a little bit more story rather than just a bunch of clinical words that help explain the way that this may be feeling to you. And if it doesn't apply, please feel free to take what helps and leave the rest. This was just my experience. So, in my family system, my sibling was the one who struggled with substance use disorder. And what that looked like was we were both under the umbrella of having active pathology and substance use, meaning John was suffering from medicating, drinking, using substances, in active denial, was very erratic, inconsistent, difficult to be in relationship with. And because of the active pathology and substance use in the family, I was also struggling with some symptoms, and mine were rage. I was pissed all the time. I was dysregulated. I couldn't get my nervous system online or calm. I had a lot of hard and rigid boundaries with others, even people who were trying to support me. And when it came to the relationship with John, I was just all done. I was really separated. I was really closed off to the idea of even being in relationship with, because it just didn't feel safe. And so in this, I think a lot of times the message that we can get is that the person with the active use or active pathology needs to want help, needs to hit rock bottom, has to be the one to initiate getting well. And that sometimes the message is all you can do until they're willing to do that is go to Al Anon, or to worry about yourself, or to have minimal contact, or those sorts of things. And so, what happens when I get that message is that I am typically, as the sister or as the family member, best friend, anyone, I'm going to be waiting for that person to get well. And what I make up is that if I wait for them to get well and they do, then I will get well. Like, if he just stops drinking, my symptoms are going to improve, and that really goes back to the first graphic of that is very symbolic of having someone in the middle. Like, if he just gets better, we will get better. Forgetting that he is one of us on the outer ring and that we're all suffering from the pathology or substance use that's happening in the family. So, the problem with this is I feel just as dependent and just as powerless to the pathology as he feels to the active substance use. And so no one gets well in this graphic. There's one way that this could go, and that is that he stays the same and or he worsens. And what that means is I stay the same and or I worsen in my symptoms based on how he's doing. And that really is because if you see the shackle, that is because when I'm in relationship with someone in active pathology, and I don't have any recovery or I don't have any program or I don't have any wellness moving me forward, then I am how he is. He's struggling, I'm struggling. He's doing a little bit better, I'm doing a little bit better. All of that is so closely tied. And so I'm dependent on someone who is in active use or in active pathology, which just feels really disempowered and can feel like that shackle. It can feel like I am just being dragged around by this heavy weight and I have to go wherever it goes. So that would be the first case scenario, is that however he's doing, I'm doing. The second way that this could go is that John could enter a recovery of some sort and that I do not. So, what this would look like is that John starts doing well. He's doing all the things that we've ever hoped for him to do. We've always said if he would just get help, if he would just stop drinking, if he would just go to meetings, if he blah, 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 would just take his medication. And what's confusing about this is you see over on the left side here that John is starting to do all of the things that are really healthy. He's stopped drinking, he's taking ownership, he's stable, he's focused on himself, he's building supports and community, and he's doing what the professionals in his life are telling him to do. He is following a treatment plan. When I don't also enter recovery and I am dependent on his, what I have made up will happen is that when he gets better or stops drinking, that somehow equates to me getting better. But that only works if John is in the center of the family, which he is not. Pathology and substance use are. So in this situation, what happens is I have stayed in my pathology, even though he has found recovery. And so, more than likely, my pathology, which was rage, dysregulation, hard boundaries, being all done with everyone, will simply morph and continue. It will not improve, it will just change. And so, what that means is just because he's gotten well, I don't stop being triggered, angry, nervous when the phone rings, standoffish with others, still having a hard time with my nervous system, because John stopping drinking is not the thing that is going to cure the symptoms that came from me being impacted from the active pathology or substance use. That would take my own recovery. And so even the best case scenario has happened here. He's gotten well, and I'm really confused because I'm not well. In fact, I've now morphed into having different types of symptoms than I had before. I'm still pissed. I'm still dysregulated. But I'm also showing up with some other things. Like I've got some unwillingness to do what my therapist is telling me to do. I'm not going to meetings. I'm not the one that needs meetings. He's the one that needs meetings, and he's doing all those things. And so I can finally just live my life. I've poured enough into that relationship and blah, 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 blah. I also show up with some distrust and skepticism of his wellness. So you got 30 days, whoop de doo, good for you. I don't really buy that that's going to keep going. I'm waiting for the other shoe to drop. We'll see how long it lasts. And I probably am continuing to have hard boundaries with others because I haven't done any repair or any recovery to learn how to be in relationship with others safely and how to allow them to support me. Notice that my medicator or number is still over there in the corner. There's still a lot of shopping going on, and that is my outlet for dealing with all of the fallout of being in relationship with pathology and substance use. So I just want you to notice here, this is the best case scenario. This is what I've been saying I wanted. He got well, and yet I'm still really struggling, and that could be really confusing to me. But the reason that I'm presenting it this way is to create a little bit of hope for what it could look like instead. So, the other way that this could go is that regardless of what John is doing in his lane, that I'm worried about my lane. And that means that I can enter recovery and healing at any point in any of these graphics and at any point in any day of us being a family system with this going on. Here's what that would look like. I would begin to process what I'm feeling as a result of pathology or substance use in my family. I would follow a treatment plan. I would start to address, oh my gosh, I get so triggered every time the phone rings. I'm looking on his Instagram every day to see if he's still posting to make sure he's still okay, even though I have a rigid boundary not to talk to him. I'm building up my supports. I'm prioritizing connection with others rather than keeping them at arm's length. I'm going to honor the relationship with myself by reducing the numbing and medicating that I'm doing with that shopping. And I'm going to start to identify what are healthy boundaries. A healthy boundary has to look like a screen door. It's not a closed door and it's not a wide open door. It is just enough to let the clean air in and to keep the bugs out. So I've got to have some form of balance between you're being held at arm's length and actually I can let you in a little bit so that I can get some support in what I need. I want to give this example really concretely, and I'm going to do that through talking about my family system. So, this image for me and my family was about 2 years into the process of my own recovery. So, for me and my family, John happened to find recovery or sobriety or whatever you want to call it after I found mine. That means that I was able to enter recovery and work on all of the symptoms that I was having as a result of the active pathology or substance use without him stopping his use. And he was eventually able to get there. And so this is my plea for families is you do not have to wait for that person. And even if you do, and even if they get it, their recovery will not equal your recovery. So, the beautiful thing about this is now you've got a family system where you've got two people working on active recovery, two people following a treatment plan, two people getting help from professionals, maybe two people who have their own community and self care going on, and two people who are less dependent on what's happening in the family system. I want to be clear with this statement, and I'll probably repeat it. It is not your duty to influence whether anyone else enters recovery or not. And when more people in the family system enter recovery, it does tend to be influential on others wanting to join that party. And it also influences, because there's healthier boundaries, it influences how much active pathology can really exist, which is little to none. What this means is it is really difficult for active pathology or substance use to progress or even exist in a healthy family system. So, the more people who get well, the less likely it is that that pathology and substance use can continue. And I will say it again, that does not mean that it is your responsibility or your duty to influence other people's recovery. It's not your job to get a little bit of recovery, start feeling better, and then preach to everyone else in the family system how they should be doing what you're doing. That's not how we all get well. We get well by staying in our lane, focusing on what's good for us, and starting to chip away actually at some of those codependent behaviors, start to chip away at some of the unhealthy boundaries that we have, or some of the what we call enmeshment in relationships. Like, I don't know where I start and you stop. I don't know how to extract me from you. That is what we're really trying to work on. So, your recovery has to be your focus, and it also has to take some acknowledgement that the responsibility is on you. So, I will say this a lot throughout our family recovery teachings, and that is, it is not your fault that this occurred in your family system. And it is your responsibility to treat the symptoms that you have, because no one else can treat them for you. As you saw in the graphic, was just because John stopped drinking does not mean my symptoms improved. They morphed, they progressed. So it is your responsibility to work on those things. And whatever work you need to do around, it's not fair, I didn't cause this, it's their fault that I'm in this place, blah, 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 blah. Whatever work you need to do around that, I highly encourage you to do it so that you can move into healing and recovery, and let go of some of the whose fault and blaming, and just move into healing. If you can get that piece out of your way, and you can accept responsibility over the way that you're feeling today, and you can start to work on that, that's how this whole family system is going to improve. So, what I want to encourage you to do, you can do this either through download or through just drawing this on your own sheet. So, I want you to really work through who belongs in each of these bubbles, and what are their potential numbers and medicators. And this is not to call people out. It's not to say, oh, I know what my dad's doing. He's doing blah, 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 blah. It is really to just understand this is the layout of my family system, acknowledge the dynamics that are happening in the family system. And notice I did not put a person in the middle, because that person belongs on the outer ring. So think of your identified patient, your identified person of concern, some people call it, and you're going to put them in one of the bubbles. And this may be the easiest person to start with. So let's say I put that person in the blue bubble and I say, this person is right here. It is very clear to me that they're struggling. And then just list out some of their symptoms. What are they struggling with? Are they using substances? Are they not taking their medication? Are they erratic? Are they manipulating? Whatever it is that they're doing. And then you can name a number and medicator if you're able to acknowledge it. And a number and medicator for anyone in this graphic is just something, is, I shouldn't say just, it is simply something that gets in between the relationship between me and me. So, what is the thing that I do to escape, numb, or medicate the way that I am feeling? It could be scrolling on your phone, it could be shopping, it could be exercise, it could be overworking, it could be a number of things. And what is it that that person escapes to or with? So, you'll start with that person, since they may be the easiest to identify. And then you'll look at who else is in this family circle, who else is really a player here. So you might do yourself next. And who are you? And what are the symptoms that you are carrying? Is it an overindulgence in information about the person, which is also known as codependency? That while this person is addicted to substances, or while this person is an active manipulator, I am obsessed with having more information about them. What medication did their doctor put them on? Are they compliant? Are they going to meetings? Are they actually doing all the things? Like, I'm so in it that I don't even know that that's become my obsession, and that I am so dependent on them that I am doing however they are doing. Some other examples of symptoms could be that they could be quite real medical symptoms. They could be, I have all this GI stuff going on that I didn't used to deal with. Maybe I'm having panic attacks. Maybe I'm not sleeping well. Maybe I'm having trouble shutting my brain off at night. And therefore, now I've got this number and medicator of, I went to the doctor and I got an Ambien prescription, or I'm taking CBD gummies to just be able to wind down at night, or um, I'm spending a lot of money on things that I just don't need. So, just thinking through all of the kind of different ways that this could be presenting for you is really important. And I would encourage you to spend the most time on you and the least time on the other people in the system. Because, like I said, the goal is not to uh, be diagnosing or taking inventory for someone else and what their symptoms are and what they're numbing and medicating with. Because I think the tendency, once we've identified those things, is then to want to encourage them to work on it just as much as we are needing to work on our stuff. So, I would put a little note for yourself on this page that if you find yourself drifting into other people's bubbles, if you find yourself thinking a lot about how other people need to get well, that is part of your pathology. That is part of your symptoms. That we would name codependency. And for me personally, the way that I'm best able to identify with that is that I am focused on something outside of myself, and that sometimes that is my number and medicator. That I am so focused on other things, and that allows me to create some distance between me and the feelings that I might be having. So I want to encourage you to fill this out. And the part two of this activity would be for you to look just at your bubble, not worry about the person of concern, but looking just at your bubble. What are some of the things that you are aware of? What are some of the things that you could lean into taking accountability or responsibility for? And what would support them? So, if one of my symptoms here is codependency, or one of my numbers and medicators is checking out via video games or staying really busy, those would be some things that I would really want to be taking to my therapist, to my support people, and saying, hey, I really want to take some accountability for this behavior and I really want to work on it. With the acknowledgement that these things have developed to keep me safe. And so it's not about carrying or developing even shame around the behavior. It has absolutely developed because it kept you safe, and it's not something that's going to serve you in terms of working through the healing or the recovery. And so really starting to identify, here are some things that I want to take away, acknowledge, and then work on, and here are some things that I think I might need. If it's hard for you to identify what you might need, just take it to another person. Like, "Hey, this is something that I struggle with, and I want some accountability and some healing around it. What ideas do you have?" And really leaning into people who either have a shared experience and are in a place where you would like to be, or are professionals in this space that really know how to address this from a recovery standpoint. I know I've mentioned the word recovery a lot in this video and really want to emphasize that that has nothing to do with substances. Recovery can be anything that you are intent on healing from. And when I talk about my recovery journey, I'm not talking about substances. I'm talking about healing from the symptoms that were in my bubble and being committed to that on a daily basis so that I don't have to revert all the way back to that first graphic where you saw John was in the middle. I was super focused on him. I was struggling with these symptoms and I was shackled to however he was doing. My recovery is a commitment to no longer being shackled to any person or to their pathology or disease process. So I hope you found this helpful, and please use this exercise to work through what it did look like and what it can look like, setting some intentions around healing for yourself.